Hello everyone. Today we are going to talk about third stage of labor, and it is one of the important topic amongst all stage of labor for our MBBS final year exam. So let's move forward. So what is event in the third stage of labor? The third stage of labor compromises the phase of placental separation, its descent into the lower uterine segment, and finally its expulsion with the membrane from the vagina uh, and the placental separation. Talking about placental separation, there are two things that is happening in thoracic. One is placental separation, next is placental separation of membrane, and next one is expulsion of placenta. These are the three things that are happening. And talking about placental separation, the at the beginning of labor, the placental separation attachment roughly correspond to area of 20 centimeter in diameter, and and there is a progressive diminution of the area and successful, and finally uh, it gets separated, and the placenta gets separated by usually by the two way. The one is we have the Schultz method. One we have the Schultz method, that is central separation. Okay, let's understand by the diagram. This is called the central separation or Schultz separation. The detachment of placenta from its uterine attachment starts at the center, resulting in the opening of the new few uterine sinus and accumulation of the blood behind the placenta, and that is retroplacental hematoma. And with increasing contraction, the more and more detachment occur, facilitated by the weight of placenta and retroplacental blood until the whole of the placenta get detached. And here this is called as and this picture is of the marginal separation, that is also known as Matthews and Duncan method. The separation starts at the margin, and as it is mostly unsupported, and with the progressive uterine contraction, more and more areas of the placenta get separated, and marginal separation is found more frequently. Next, we have the separation of membrane. The membranes which are attached loosely in the active part are thrown into multiple folds, and these attached to the lower segment are already separated during its stretching. And the separation is facilitated partly by uterine contraction and mostly by weight of the placenta, as it descends down the active from the active part. And the membranes so separated carry with them remnant of Desuta vera, giving the outer surface of the chorion its characteristic roughness. And here finally we have the expulsion of placenta. After the complete separation of the placenta, it is forced down into flabby lower uterine segment or upper part of vagina, where effective contraction and retraction by uterus, and thereafter it is expelled out by either voluntary contraction of abdominal muscle, that is beer downing effort, or by manual method procedure. And finally we have the mechanism of control of bleeding that results after placental separation. Innumerable torn sinuses which have free circulation of the blood from uterine and ovarian vessel have to be obliterated, and occlusion is affected by complete retraction, whereby the arterioles, as they pass tortuously through the interlacing intermediate layer of the myometrium, are literally like they are clamped, and the leaving ligature is a principal mechanism of the hemostasis. uh, However, thrombosis occurs to occlude the torn sinuses, a phenomenon which is facilitated by hypercoagulable state of pregnancy, and the opposition of the wall of the uterus following expulsion of the placenta, also known as myotamponade, also contribute to the minimizing the blood loss. We can see, if you see this picture, the running through the interlacing muscle fiber. This is the vessel is running through the interlacing muscle fiber and literally clamped due to the retraction of uterine muscle. The vessels are contracted, clamped, and this result in the control of bleeding. Now talking about the clinical course of the third stage of labor. The third stage include the separation, descent, and expulsion of the placenta with its membrane. The pain, for the short time, patient express no pain. However, intermittent discomfort in the lower abdomen reappears and corresponding with the uterine contraction. And before separation, per abdomen uterus becomes discoidensive, form infill, and non-palatable, and fundal height reaches slightly below the umbilicus. And per vaginum examination, there may be slight trickling of blood, and length of the umbilical cord as visible from outside remains static. And after separation, it takes around 5 minutes in conventional management for placenta to separate. Per abdominal examination shows that after separation, there is uterus form globular and palatable. The fundalitis rests slightly as the separated placenta comes down in the lower segment, and the contracted uterus rests on top of it. and slight bulging in the suprapubic region due to distension of lower segment by the separated placenta that can be seen. And in per vaginum, there is slight gauge of vaginal bleeding. Permanent lengthening of the cord is established, and we can have the expulsion of placenta, and maybe the expulsion is achieved either by voluntary bearing down effort or more commonly aided by the manipulative procedure. The afterbirth delivery is soon followed by the slight to moderate bleeding amounting to 100 to 250 milliliter. And the maternal sign, there may be chills and occasional shivering, and the slight transient hypotension is also common. And now we will talk about management of third stage of the labor in the next video, and this is one of the very important topic, and we will discuss solely entirely in the new video. Please check out the new video on management of third stage of labor. Thank you. Till then, we will meet again. Thank you.